the rice test is a very important component of breast implant sizing in my practice. It's probably the most important method. So what do we need? Now I've been shopping and I'm going to be your model. The first thing we need is a trial bra. So first of all, think of what sort of size you are and want to be and go shopping. So I went shopping yesterday at the local Kmart and I brought some bras. I don't know that they're all going to fit me, but we'll give it a try. Now this is not the kind of bra to get. So I bought this just to show you what not to get. It's got a structured cup and it's got some padding in it. So if you put a rice sizer in there, you're not really going to see what size you actually are. So don't use these. This was $4.50. Get rid of it. This is okay, and this is also not bad as a post-surgical bra. So this was mighty $12, I think. And what this is a, it's got a cup size. It's not a sports bra. Don't use a sports bra. Sports bras minimize. It's got a cup shape, but it's wireless and it's got no structure to it. That would be fine to use. My preferred type is this $9 sample and something like it. It doesn't matter what brand they are, just buy something cheap. And it's got underwire. Here we go. It's got underwire, but it's got no structure in the cup. The cup is completely flimsy. So the underwire gives you a base to the breast, which I think is quite useful. So this is what we're going to use today. Elegant, don't you think? You need a measuring cup. This is one I bought for $6 from Coles. It goes to 500 mils, which is probably enough. We need some stocking socks. I think that was $4 for 6 pairs. And we need rice. So here's the rice. Now, what I suggest you do is, if you're fairly small, start with 250 mils of rice and go up by 50 till you get in your size range, then go too big. If you're bigger, fuller figured, like me, then start with a bigger volume of rice. So we're going to make a rice sizer in a minute. So what do you think? Pretty good. So I've got my stocking socks, I've got my measuring cup, and I've got some rice, and I've got one of the stocking socks out of the packet. So first of all, I'm going to make a 500cc or 500 mil rice sizer for me because I'm a bigger guy, but you don't need to start with this amount. I'm going to measure out the rice, and that we've got 500 mils accurately. Let's make a sizer. So here we go. Rice into the sock. And when you tie it, don't tie it down here. You want to tie it really up near the opening of the sock because you want it to be flimsy and you can make a flat pancake out of it. And I'm going to label it 500 because I might make a 400, 300 or 600. It's easy to do. But I'm going to write 500 on this, otherwise I'll confuse myself if I make more than one. Now, what we do is we put it in the bra. Not bad. And then I'm going to put, this is one I made earlier, same size, put it in the bra. Now you pat it around. The reason to do it loosely is if it's like a ball, it sort of leaves a lot of the bra empty. So a non-structured bra with underwire for $9, and you can mold it around and actually use the cups of the bra to make a good breast shape. Once we've done this, then we go, okay, now what do I do with this? Well, now what you do is you try on your clothing. Don't look at the breast itself like this. It's kind of weird, although it's some help. But the key to this is now try on all your clothing, swimsuits, tight clothing, low cut stuff, summer stuff. Walk around the house, vary the sizes. Don't vary the sizes by little tiny amounts. Minimum 50 mils variation, otherwise you'll get confused. When you've got a couple of sizes or the very size that suits you well, keep them and bring them in the bra in for your consult with you. This will accurately tell you what size you should have as breast implants. It's by far the best method. So I'm going to show you what I'm going to do with this. I quite like this. Then that's rice sizing. Once you've got the size in the bra, then put clothing on over it and see what you think. What do you think? Not too bad. Could get used to this, I think. And if you're a smaller person, then start with 250 mils as the first sizer. Make a 300, 350. And if you're a bigger person with a bigger frame, then you need to start a little bit bigger because it's all contextual. Don't worry about cup sizes, just worry about how you look. The whole thing about implant sizing, it's about what you're looking for in your breast size. Don't go too big, please, just feel right. You've got to not only go to the beach in a bikini, but you've got to go to Auntie Maud's funeral or work. And so your breast size that we choose has to suit you for all aspects of your life. And I know of no better way than to use the multi-method of cross-checking sizes, what's in your head, office measurement, implant catalogues, and the RISE test. But if you had to do one test, this is the best one. Thanks for watching.